Hello Health on LAE is presented by the Ochsner Health System, a nonprofit, academic, multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 7 hospitals and more than 35 health centers located throughout Southeast Louisiana. Ochsner, healthcare with peace of mind.
We call it our More Money to Spoil Our Grandkids plan. With a Humana Medicare Advantage health plan, we get tips on how to make our money go further. We even get a health finance and benefits statement called Smart Summary that helps us find even more ways to save. And we like more.
More of what you want, because you deserve more.
Hi, I'm Tom Bagwell, and good evening. Welcome to Hello Health, a partnership with LAE, the Ochsner Health System, and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight's topic, preventing cardiovascular disease, and our guest is cardiologist Chip Lavie, Ochsner's Medical Director of Cardiac Rehabilitation and Preventive Cardiology. As always, we begin by introducing you to our guest. Dr. Carl Chip Lavie received his medical degree from the LSU School of Medicine in New Orleans. He completed his internship and residency here at the Ochsner Medical Center. He finished his fellowship in cardiovascular training at the Mayo Clinic Foundation Graduate School of Medicine in Minnesota. Dr. Lavie is a fellow of the American College of Cardiology, and as we mentioned earlier, he is the medical director of cardiac rehab and preventive cardiology at Ochsner. He is also the author of almost 500 medical publications and serves on 17 editorial boards. It is our pleasure to welcome Dr. Chip Lavie to Hello Health. Great to have you with us on the program.
It's a pleasure, Tom.
Well, some of our guests come from all over the globe and end up working in New Orleans. You were born and raised here, right from our neck of the woods. Tell me about growing up in New Orleans.
Well, I was born and raised, as you mentioned, in New Orleans. I'm a graduate of Jesuit High School, and actually have, other than spending some years at the Mayo Clinic for my cardiology fellowship and on the staff, I've been here my entire life. You
have 4 children, you said, and some of them are showing an interest in medicine already.
Actually, 3 of the 4 children right now planning on going to medical school, and I'm very encouraging in that direction.
What are you telling them about the downside of medicine?
Well, it's a lot of work and it's a lot of studying, and you know, certainly people think that it's a lot of glamour and the income's good, and that may not always be the case, and it isn't the case for people. So you really have to pick medicine because you love it and because there's a lot of good ways to help people.
What are the upsides? Because you're going to give them that side of the story too, if you haven't already, I'm sure.
Well, I mean, just what I just mentioned, that you can help people. You do have job security, and unlike in many fields right now, and there's a tremendous amount of information that you're learning every single day, and it's just a lot of fun.
Perhaps they were inspired by their father, but who inspired you? What made you want to get into medicine?
Well, I had some great science teachers at Jesuit High School. I can remember Harry Clark in chemistry, Willie Brown in physics, and one of my JV basketball coaches, Larry Salters, in biology. All really inspired me in the sciences. And then I went to LSU College and actually was planning to go to dental school. I quickly realized that I enjoyed the medical aspect a lot more and maybe didn't like the idea of doing the tedious work in a small cavity with my hands, and I think I made a good choice switching to medicine.
A couple more points of reference. Dr. Lavie's areas of expertise include non-invasive imaging, echocardiography, nuclear cardiology, cardiac rehabilitation, exercise physiology — we'll be talking about exercise tonight — and preventive cardiology, the main topic of our discussion this evening. Well, doctor, why is heart disease such a big problem in this country, and what is the impact of that disease on our society?
Well, for many years, coronary disease and cardiovascular disease has been the leading cause of morbidity and mortality in the United States. Well, now it's not just the United States, the entire world. #1 cause of death is cardiovascular disease. And what happened was, many centuries ago, we were hunters and gatherers. So everybody used to go out and have to work for their food. And so there was a lot of physical activity. The diet was lower in saturated fats and some of the bad fats. And what's happened as society has become industrialized is that the physical activity has dramatically fallen. The saturated fat has gone up, and so with that has been a skyrocketing of cardiovascular disease. In fact, right now, heart disease is the leading cause of premature death in our society. Stroke is the leading cause of long-term disability. And diabetes, one of the major risk factors for cardiovascular disease, is also a major health concern. No, there's no question that cardiovascular disease is not just a United States problem, it's a worldwide challenge. It's a tremendous cost to our patients, healthcare systems, and society, measured in billions. And certainly, and importantly, many patients at risk are currently not even identified, much less being fully treated for this disease.
Are you pointing out that there are children now developing heart disease in some effect that aren't showing that yet, but will in later life?
Absolutely. I mean, this disease starts very early, and certainly the beginnings of cardiovascular disease are seen in teenagers. And some of the best studies are from here in Louisiana, the Bogalusa Heart Study, which Jerry Berenson, who was one of my mentors at LSU Medical School, has been a leader in this field for many years.
We'll talk more about children later in the program. Why is preventing heart disease so important?
Well, I mean, preventing a disease that's the leading cause of death is certainly critical. But I think this slide that's on the screen makes the point. This is actually a cross-section of a coronary artery, which is sliced in the middle. And you see on the outside the walls of the artery. At the bottom of the slide, you see the cholesterol plaque. And in this case, this plaque is narrowing this artery by about 30%. Many years ago, people thought that what the cause of heart attack was the cholesterol gradually building up and eventually closing off the artery. But now we know that that's not the case. The case is generally what's shown in this slide. There's plaque fissuring and rupturing of the plaque. And then on top of that, if we form a thrombus or a blood clot, this blood clot can then propagate and eventually close off the artery. Or the blood clot can break off and travel downstream, and this is, both of these things are occurring. The second thing about this slide is that many heart attacks occur not in 70, 80, 90% blocked arteries, but they occur, as in this case, in the 30% blocked arteries. And many people have many of these types of lesions. The other thing, many people think that a heart attack is a sudden event that happens over seconds and minutes. That can happen, but very often a heart attack is occurring over days, weeks, or even months, because this is an ongoing process.
People watching tonight, you probably scared them to death, because thinking, well, I'm not in the 70, 80, 90% blockage range, I'm okay. What you're saying is that's not the case.
That's certainly not the case. And if you think I scared them with the previous slide, this slide I think is going to even be more scary. This was a study that came out in Circulation in 2000, which is our leading research cardiology journal. But before talking about this data, I'd like to wind back a half a century to the Korean War. In the Korean War, there were studies done where they did autopsies of the kids who died during the war. And it was very surprising then that they already showed signs of atherosclerosis, or the fatty streaks of the cholesterol deposited in the walls of the artery. And so that was news at the time, that this disease started very early in life. Well, now, fast forward to modern day, and this study was, again, published in 2000. And unlike, these were not young people who died in a war, but they usually died violently, typically in automobile accidents. But we're defining disease on this slide as the prevalence of an LAD, that's the left anterior descending, the most important artery of the heart, having a 40% lesion. And just focus on the right of the slide, the 30 to 34-year-old age group. In women, already at age 30 to 34, 8% already have a significant blockage in this vessel. And in men, It's 20%. That's 1 in 5 men aged 30 to 34 already have a 40% or greater blockage in the most important artery of the heart. And you can imagine what the statistics look like in 40, 50, 60-year-olds. So this is a systemic disease that starts very early. And if even the minor lesions cause problems, then we really have to do a better job of preventing this disease from starting up and propagating.
We now know that the hardening of the arteries doesn't just affect only the heart. Talk about some of the other areas.
Yeah, absolutely. This is a systemic disease. I mean, the heart gets probably most of the publicity, but every vessel in the heart is affected by atherosclerosis. It can affect the brain arteries and lead to transient ischemic attacks and ischemic stroke. Certainly the heart is the one that gets the most attention, causing chest pain or angina and causing myocardial infarction or heart attack. But it also affects the arteries that supply the kidneys, it affects the arteries that supply the legs, and you can get claudication or leg pain with walking, and certainly you can get critical ischemia where the blood flow is blocked off critically, causing rest pain, gangrene, necrosis, leading to amputations. That we see in many of our patients. So this is a disease that affects every organ in the body, and again, we have to attack it with a multifactorial approach.
Let's talk about how heart disease gets started now at an earlier age, as you point out.
Yeah, well, one thing that we are recognizing that there's no such thing as a sudden heart attack. This takes years of preparation, and certainly a major factor that we're dealing with is the epidemic of overweightness and obesity in our society. This is not just an epidemic of adults. Well, it is. It's 70% of adults are either classified as overweight or obese. But this is an epidemic in children as well. The epidemic is starting at very young ages, and it's causing major problems. In fact, Louisiana is one of the leaders. Luckily, we have Mississippi right next to us, because otherwise we'd be the top in the country in the prevalence of overweightness and obesity. This leads to many bad factors. It raises blood pressure. It raises the bad fats in the blood like triglycerides and lowers the cardioprotective HDL cholesterol. It leads the LDL, or bad cholesterol, to become more sticky and more likely to get stuck in the plaque. It increases inflammation. It causes glucose abnormalities that can lead to metabolic syndrome, which is a very strong risk factor for cardiovascular disease, but it also leads to diabetes, which is the strongest risk factor for diabetes, so it's not, for cardiovascular disease. So it's not surprising that obesity is associated with such high risk. Now, this is another fact that I think I found was very scary for a study that I saw recently in the Diabetes Journal that showed that of kids born in the year 2000 in the United States, that 35% are projected to develop diabetes in their lifetime. And the prevalence is predicted to be well in the 40s and close to 50% for African Americans and Hispanics, but even in Caucasians, it's about a third. So that's a scary statistic, that for babies being born in this decade, that if the current trends continue, that's not even to mention if they get worse, and they've been progressively getting worse, that we are just going to have an epidemic of obesity, diabetes, and even more so of cardiovascular disease.
Is there a general correlation? Do the statistics tell us that someone who is overweight is going to have more blockage, and someone who is the right weight or underweight is going to have less blockage? And I know I'm being simplistic, but is there research that indicates that, or you can't draw that correlation?
I mean, as a general rule, I mean, but certainly you know individuals that will be morbidly obese and they have crystal clean normal arteries, and then you have a thin person that has badly blocked up arteries. But as a general rule, because obesity affects so many of the known risk factors, the obese develop far more cardiovascular disease than do the lean.
This is something that's getting more and more attention now, and that's a very good thing. That heart disease is often thought of as a man's disease, but our thinking is changing. Doctors have known for a while that's not the case, and now statistics are telling us otherwise, and the message is getting out, but let's hopefully make that message stronger tonight.
Well, there's no question that women do lag behind men in disease, and typically the stat we say is that they develop cardiovascular disease 10 to 15 years, and the best statistic is probably 13 or 14 years later than men. But coronary heart disease is the leading cause of death in women. 1 in 2, or somewhere between 1 in 2 and 1 in 3 women will eventually die of heart disease or stroke, whereas only 1 in 25 women will eventually die of breast cancer. You know, and so women, if you ask them, what are they worried about? Almost all will say cancer, and especially breast cancer. But by far, the leading cause of problem is cardiovascular disease. And actually, if you look at stats now, more women are dying from heart disease than men. And that might be misleading because they lag behind men, but because women live longer, for lifetime risk, more women are actually dying in the last few years of cardiovascular disease than men. Now, if you age-corrected, men are ahead, but when you look just at total numbers, women have more disease. So certainly, we should not be saying this is a man's disease.
Isn't part of that if a man is having heart pain and chest pain, honey, get me to the hospital, I think I might be having a heart attack. If a woman is having heart or chest pain, boy, this is a bad day, I really need to get some sleep.
Well, I mean, certainly there's some truth to the fact that, and this may have been even more true years ago, but it may not be recognized as frequently as women as in men because of the perception that women don't get heart disease as much. And so when a woman has some symptoms that resemble a heart attack, they may pass it off as indigestion, whereas the wife is telling the man to rush to the hospital, and not vice versa. We're
looking at some pictures now, some video actually of your unit. This is Dr. Richard Milani working with some patients there. He was actually the first guest of this program when we began. Wow. Talk to me about some of the things we're seeing and the importance of exercise for women and what you're doing there at the center.
Yeah, well, I mean, we run probably the most well-known cardiac rehabilitation and preventive cardiology program in the United States. I mean, as far as if you look at publications in exercise in coronary patients, Richard Milani and I probably publish more papers than any place in the world in coronary disease patients. And certainly women are a big part of this, and we've published many papers in women. Actually, there are some risk factors that are stronger risk factors in women than in men. One of them is obesity. A second is triglycerides. HDL is even a stronger risk factor in women. Women have higher levels of HDL, but yet low HDL is a stronger risk factor for disease in women than in men. And exercise plays an important role. Women are certainly, as a gender, certainly there's lots of exceptions, but as a gender, they're more sedentary than men, and they have lower levels of physical fitness. And so they actually need the exercise probably even more so than men.
What's the latest research on the impact of alcohol on cardiovascular disease?
Well, I'd like to say that I like to refer to this as alcohol deficiency as a risk factor for cardiovascular disease. And that's probably one of the few risk factors that we don't have a lot of here in New Orleans is alcohol deficiency. And the reason why I say it like that is that the epidemiologic studies, and one is shown here on the slide, show that non-drinkers actually have more cardiovascular disease than do people who drink small amounts of alcohol. The problem is that as you increase the alcohol, you reach a plateau, and some studies show that plateau happens at 2 drinks. This slide shows it happens at around 3 drinks per day. And then you have an increase in cardiovascular disease. So we call that a U-shaped curve. We had a major paper published about 1.5 years ago in the Journal of American College of Cardiology, which is our leading clinical cardiology journal. It was called Alcohol and Cardiovascular Disease, a razor-sharp double-edged sword, because there's so much abuse of alcohol. And a lot of people don't really know what a drink is. And that's one of the problems. You know, we have hurricane glasses here in New Orleans.
That's more than one drink.
And so when we define a drink medically, we are meaning a 12-ounce beer, 1.5 shot of spirits or hard alcohol, or a 5-ounce glass of wine. So the person who fills up the hurricane cup with rum, they may have 5 or 6 drinks, medical drinks, in that one drink. And somebody who puts 20, 25 ounces of wine in a big cup, they have 5 drinks and 4 or 5 drinks in that. And so that's an important aspect, is that when you look at the data, I would recommend that the protective amount of alcohol is probably 1 drink per day for a small person and 1 to 2 for a large person. And a drink is defined as shown in this slide.
Okay. Our guest is Dr. Chip Lavie, and tonight we're talking about understanding cardiovascular disease. Dr. Lavie, what are some things we can do to prevent heart disease?
Well, there's a multifactorial approach. Obviously, one of the main things that we have to get people is to not smoke, not to start smoking, and we got to get people to stop smoking. You have to set goals. Smokers have to set goals and make it a high priority, and there's certainly programs and prescription medicines that can help them. We got to control body weight. Even if we can't get weight to be ideal, we have to get people closer to their ideal body weight and prevent the continued climb of weight in adulthood. We certainly have to control blood pressure, at least to under 140/90, but probably even lower than that. And for people with diabetes or kidney disease, the guidelines say below 130/80. And certainly a thing that's neglected is regular exercise. Exercise helps almost all aspects. It raises the cardioprotective HDL cholesterol. It lowers weight. It lowers blood pressure. It has many protective effects on the heart. One of the things we've published a lot on is the psychological benefits of exercise, decreasing depression, anxiety, and hostility. And that's something that's really been neglected, but it's also a strong risk factor. We have to control blood sugar, really ideally try to prevent diabetes to begin with. For people who are at moderate and high risk, a daily baby aspirin can lower their risk of cardiovascular disease.
81 milligrams.
81 milligrams, and there is still some controversy about, well, who should not take it, because aspirin can increase the bleeding disorder. So if you're really low risk, you probably shouldn't be on aspirin, and obviously if you're very high risk, you should be. At the moderate risk, I think that's best for a physician and patient to decide that together. Certainly we have many excellent medications for cholesterol. The one that gets the most publicity is the statins. They're the best medicines to lower the bad cholesterol, and they have so many studies showing heart attack and stroke reduction. We also have medications that raise HDL like niacin and fibrates, and medications that lower the triglycerides, which are fibrates, niacin, and high doses of omega-3 fatty acids. And with all of these things, we still need to get people to improve their diet, eating more fiber in the diet, more fruits and vegetables, lowering saturated fats, and especially trans fats in the diet.
There's been a lot of talk and publicity lately about the benefits of eating fish and taking fish oil. What does the latest research tell us about that?
Well, this has been something that I've been interested in for 2 decades. I actually wrote my first paper on fish oils in 1987 when I was a fellow at the Mayo Clinic. I wrote a book chapter 15 years ago, and in the past year I've published 5 papers. One of them has gotten major press that came out in August. I've probably done over 50 interviews and 500 things written in the press. So I think there's tremendous evidence that omega-3 fatty acids provide cardiovascular protection. The guidelines right now are saying that healthy people should be getting about 500 milligrams of the good stuff, which is called EPA and DHA, which is abbreviations for eicosapentaenoic acid and doxahexaenoic acid per day. And for heart patients, it should be between 800 and 1,000 milligrams. So to get that kind of, if you're going to get that in a diet, it would be 1 to 2 fish meals per week for a healthy person, and it would take 4 to 5 fish meals per week for a heart disease patient. Generally, there's not going to be very many people eating that much fish, so the heart patients are probably going to need to take supplements. But this is certainly an important protective mechanism, and there's a lot of publicity. This is a quote that I saw in the New England Journal 20 years ago, and I think it's true today, that fish oil is a whale of a story that, not surprisingly, seems to be getting bigger with every telling. And one of the last line in my last paper was that I think this represents a fish tale with growing credibility.
You take fish oil?
I do.
And how much per day?
Well, I'm taking probably equivalent of about 800 to 1,000 milligrams per day, but I also do eat a lot of fish. One of my favorite foods is sushi, and I eat a lot of salmon and tuna. Finally, so I probably get a very high dose.
Earlier, you alluded to the importance of exercise in preventing cardiovascular disease. In today's I just don't have time world, spend a minute of getting people started on an exercise program?
Yeah, I mean, there's certainly, if you ask people, you know, why they're not exercising, the leading reason is that people say they just don't have time. And so, I mean, this is obviously a joke, but you know, what fits your schedule better, exercising 30 minutes a day or being dead 24 hours a day? And that's what the national recommendations are, that everyone should be doing about 30 minutes a day of physical activity. Now, people have to make it a high priority. They have to figure out in their very busy schedule how they're going to get it in. It's either going to be before work, in the middle of the day, right when they finish work. At some point, they have to have a plan that's going to fit, you know, for the day that they're going to have. And then people have to know that they have to start slow. They can't, you know, go out and do an hour of hard exercise in the middle of a 100-degree summer day.
Be realistic in your expectations.
Yeah, you have to start slow and build up. And then for people who have, especially people above the age of 40 who have many risk factors, they probably need to get their doctor to clear them for a more vigorous exercise program. Certainly just a slow walking program, everyone can do that. But if they're going to exercise more vigorously and they've been sedentary for 20 years and have all the bad coronary risk factors, they probably need a doctor to clear them, and maybe they might even get a stress test.
Doctor, we thank you for your passion about the issue, and that is obvious, and we thank you for the information and education you have provided us tonight. Thank you so much.
It's a pleasure, Tom.
Great to have you with us. Well, here's a look at what's coming up on Hello Health in the month of October. We've got 3 terrific Hello Health programs lined up in October. On Monday, October 12th, Dr. Dmitry Niazov will be here on LAE to talk about genetic breast cancer. And on Monday, October 26th, the urologist Richard Van Langendonk joins me here on this program to discuss modern advances in testicular and prostate cancer. Finally, on Wednesday, October 28th, Dr. Claude Williams will be at Ralph's on the Park. The topic of his presentation will be hand and arm pain. To make an appointment with any Ochsner physician or to learn more about upcoming Hello Health seminars, you can call Ochsner at 504-842-5669. That's 504-842-5669. And as a reminder, you can re-watch tonight's presentation or any of our Hello Health programs on our website at WLAE.com or on Ochsner's website at ochsner.org. Just type Hello Health in the search areas. Our thanks again to tonight's guest, Dr. Chip Lavie, to Ochsner and Humana for making this program possible. And our final thanks, as always, is to you for your support of this program, Hello Health, and our station, LAE. More than television.
Hello Health on LAE has been presented by the Ochsner Health System. 600 physicians in 80 medical specialties working with a team of more than 10,000 employees to provide nationally recognized healthcare across Southeast Louisiana. Ochsner, healthcare with peace of mind.
I call it my I've got a healthier plan. With the Humana Medicare Advantage Health Plan, I get more health and wellness options like fitness programs, health management classes, and a 24-hour nurse line. I can even talk with a Humana Market Point representative whenever I need to.
More of what you want, because you deserve more.